So those people are going to struggle. As much as they want to change, and they know that I'm saying some sensible messages, it makes cognitive sense. It fits with the science as they know it. They also have the devil that says breathe. And of course, if it's uncomfortable, you don't do it. Of course, as I said, most people can hold this for a moment. I mean, all these mewers who say, I'm mewing all the time, I haven't got change. And I said, are you sure you've got your mouth closed? And they go, yeah. And I think it's really hard to change. It's a really tough thing to do. And of course, I think a lot of people are struggling because they lack tongue space, and they're going to need some assistance. You know, not just transversely can help, but we've got a three-dimensional problem here. And I think what we've got to do is we've got to work as teams, and trying to help people, trying to give people more tongue space will be really helpful and powerful in them making their journey forward. And at the moment, I'm really impressed with sort of the Marpe and some of these things. But remember, that's mainly transversal. It's not sacral, it's not vertical. We've got a three-dimensional structure. Is that moving? So, you know, we've also got to get that, what we refer to in dentistry, the AP direction, you know, the front to back direction. We've got to get some distance from the back. That and the vertical is being a lot more difficult to achieve. And so we've got a lot of work to do to help people change. And of course, you can have surgery. Surgery can be very profound. And a lot of people are doing surgery, and of course, you get that type of change, you will help someone change themselves. Of course, I want to give you a little bit of knowledge and information as well. One of the points I made recently to many viewers who are completely unaware of this is about suction. It's not about pushing. I'm not an advocate of hard mewing. I've had a lot of people contact me saying that that's caused a problem. It's about suction. It's about posture. It's about light forces over long periods of time. And if I stand with my tongue down, this is my most comfortable posture. But if I fully engage my tongue and I get a suction hold, my comfortable posture will change. And it's vital to change what people find to be comfortable. People will drop back into comfort, whether they need some assistance to change or not. And of course, one of the things I've found accidentally is that if you get a good suction hold and you can move your head back so it's more on balance on the roof of your body, then you engage your abdominals as you walk. And I think it's very simple. You know, we've all got forward head postures, I think, because of craniofacial dystrophy. Our heads come forward. We're not using the front muscle group. We're overusing the back muscle group. We're getting bulges here and here for boys and girls, like because we're not using this group. And if we can get the head up and back, hold it back with suction in the back third of the tongue, not the neck muscle, then we have the front muscle group working to stop ourselves falling backwards, as well as the back muscle group working to stop us falling forward. But we're not overusing the back muscle group. And that's a modern epidemic of overuse getting backwards. The more we can stand up, the more we activate the deep frontal line. And my observation was the realization that if you fully engage the back third of your tongue, you get your head back, you get yourself in balance using it. As you walk forwards, you activate your abdominals, but also you're almost naturally barefoot walking. That observation really helped put a lot of mewing together for me. And I think that's the realization of where we've got to get people so that it's a whole body transformation. And once you manage to gain a good balance, then you change. It's one thing to do exercises, and they can be very, very valuable. Unless you make an exercise part of your daily habit and routine, when you stop doing the exercises, you will slowly relax. But if we can use exercises to either build a constant habit or a change in posture, then you hold it, and then you change permanently. So we have this duality with form and function, and I think that it's often useful to get assistance to gain changes in structure. But we're all familiar with what we refer to as muscle memory. Well, I want to add into the lexicon this structural memory. So for most of you, the form you have has been informed by the function and posture that you have exhibited all your life. That means that your current function is your most comfortable. That means it will become your default. So that's structural memory. And sometimes we're going to need to help people get a little bit of change to help them going. And effectively then, once they get a little bit of change, that will help them gain further change, and we can elicit a virtuous cycle of change. Now, what we need to help people is mechanisms. So we've got feedback and training devices. I know Sandra's working on a device. I know I met the guys here with the tongue training device. Remind me the name of the tongue training device? The beauty balloon. So we've got a tongue training device. We've also got the REM Remastered, one of our sponsors, got two sponsors over there. So these are devices to help remind you to do things, and that's really important. Now, I'm fascinated with this Neuralink and where we're going to go, but that is certainly not yet. But it gives you some illustration of the potential for change. Of course, we've got motivation. It's great to be motivated, but people need to know what to do, when to do it, and how to do it. And of course, again, I don't have all the answers, but I am asking the right questions. And of course, we've got training, repetition. We've not even explored the biochemical aspects. I'm sure that's a great area that will need to be explored at some point. And of course, we can also look at the body posture and function. I'm going on to Vegas after this, and I'll meet Naudi, who came up with this concept called functional patterns. I've seen some really good outcomes from. I'm on a journey. I'm exploring things, as in meeting a lot of you will help me on this journey. We've got an epidemic. I mean, Sandra's raised awareness of this with her book Jaws, but I talked to an ENT, an otolaryngologist in the UK, and he estimated that 20% of people over 60 were going to be dying a decade early from sleep apnea and its consequences. What we know about OSA in the youth is, its impact on IQ, life quality, and facial effects. Faces don't look as good. Of course, this is this duality of health and beauty. And in many ways, this double-edged sword is good for us. In many ways, this double-edged sword is bad for us. Because, it can be dismissed as a beauty is bad. And yet, health is beauty. Now I'm working on trying to, I have been working on trying to work north with trying to get facial changes. And I've been working with Marpay, this crazy neck headgear devices I've got, and I've got some nice results. And it's encouraging because they're that group, 10% of the 20% of the population over 60 are affected. We've got to move north, and we've got to work with a collective team to help humanity. Clearly we've got to really work with prevention. That's vitally important. And then, it's great being here. This is my first attempt at organizing something. We did it from a very late start. It just takes so much longer. It really does. So much more to do than I ever imagined. Anyway, for 2005, for the weekend of the 6th of September, we're organizing something in London. That gives me a little bit more time. So I've already got these two speakers organized because I thought I'd get some big names who supported me signed up. So they're listed already. And on the back of that, we want to get a 2-day event going in London. I'm hoping that's going to be a little bit easier because I live close by. But also, that's going to be my father's birthday. Either that will be the first remembrance, or he will be there. The one thing that really spurred me forward to try and attempt to get my father some recognition before he either dies or loses his marbles. And I don't think he's going to lose his marbles. He's still, he's still just as cantankerous as he ever was. But that will be the next event, and I'd like to then start promoting that event as soon as possible, right away. Then I'll finish up with some news. I want to keep this short. I want to use this mewing phenomenon to gauge momentum, to gain structural change, society change. And I want really to use events like this to try and get a community, volunteers. I'm really looking for volunteers and people who want to work together. As I say, I'm pathologically disorganized. I'm really good at coming up with ideas and looking at the long term, but day-to-day management, I really struggle with. And I want to start this community project that I want to try to algorithmize the human facial structure using an open source community project. And that's what we're going to try and focus on. And the next focus is to get people together. There's lots of people, youngsters mainly, who are effectively experimenting on themselves. And also we want, in the work of prevention, getting parents to scan their child's face. We want to make a really simple app that's free, that you can scan your face, scan your child's face, and bank that information. Because with big data, we can do big things. And everyone's talking about AI and the latest thing. It's not as clever as you think it is, but it is quite good at looking at that. And it is very suitable for this project. And I'm talking with some people in Silicon Valley, and we think we can build something. As ever, I'm a little bit ahead of the game. What I'm trying to do is not possible. But I think we can move that forward. And then I need to cover my court case. So the last 7 years, I've been in legal practice. That's really drained what I can do. It's really drained my time, massively my money. However, it looks like we're going to win, and we'll win very. However, my insurance company turned around to me and said, "You're a bad risk." And you know what? I wouldn't insure me. So I've had to go to independent. I won't go into it. That was the next rest this summer. And I've got insurance, but I'm not taking any new payments. We're gently winding down. I'd love to go back to the clinical dentistry, but unfortunately, an event like this really damages your love. But I think maybe I could add more value in not treating individual single patients, getting out there to network, meeting more people. I don't have all the answers. Many of you have elements of the truth and the way forward. And so we need to work as a team to not only understand these, but promote these and get these ideas out there. And one thing we one thing this court case did show was the balance of evidence. The allegations against me that I lacked adequate objective evidence for what I was saying. And I think I do. I think on balance of probability, the right, or what came over strongly in the court case, was the conventional consensus also lacks adequate objective evidence. So why did they hold themselves higher than us? And then off the back of that, we're now able to put pressure on the system in the UK in regard to consent. You need to know where to poke the tiger, where to push things to get institutional change. And it looks like relatively quickly we will get change in the consenting process in the UK. We will force general dentists to make patients aware of their options, the options, regardless of whether some of the outcomes are anecdotal. Because when you actually look at the balance of evidence, a lot of the treatments being provided by the current consensus are also anecdotally supported. So if you're going to be recommended one anecdotally supported treatment, then, well, you should be told about all of the other anecdotally supported treatments that you may want to hear. And I think early treatment, expansion, functional appliances, myofunctional therapy and training, I think people would want to know about that. They would want to know about that in time. And it's very likely we will get that implemented in the UK relatively quickly. And then once that's implemented in the UK, the rest of the Commonwealth will follow. All the countries that use British common law, so Canada, Australia, New Zealand, will follow suit. They'll have to. And then I'd imagine it will not be long before the US has to follow suit. And we're precipitating a consultation process relatively soon. And then people are going to have to discuss it. All we want. In 2009, I started a campaign, letter writing campaign, to get a debate on etiology of management. I felt it was unacceptable. The consensus of orthodontic knowledge didn't understand this, and I said we needed to discuss this and talk about it. And we're gently making headroads on getting that discussed. But of course, all we've ever really wanted is full, free, and fair discussion and engagement. And that's my objective. And together, working as a team, we can achieve far more than we can as individuals. And I really want, at the end of this, people coming forward to me, telling how they can help, what they can help with. And I need some really well-organized people. Because that's what I need, some communication managers, some organized people, and from the back of that, we can start creating a movement to gain reform. And that's what we need. So listen, we've got some great speakers lined up. One of the first symptoms of this change that I refer to as craniofacial dystrophy is breathing issues. I think there's so much more than that, but let's focus on one subject to begin with. So the events today will be a little bit breathing focused. That's a good thing. Thank you very much for coming. Thank you very much for the speakers, and thank you very much for the organizers. I think, if I'm right, the next speaker, this is written in a very bright yellow, so I can hardly even read this. Is it? Yes. It is going to be Victor and Sydney Avis talking about the Airway Connection. And of course, they've got this campaign, and I'd love to work with them on the campaign because they're doing similar things to me. They've got a great setup. Got a great campaign. Listen, thank you very much, guys. Well done.
Hi, can everyone hear me? Can everyone see me? If I had a booster, it would be better. Okay. Hi, I'm Sydney Avis, the executive director of a nonprofit, the Airway Revolution Foundation, and someone who personally struggled with an undiagnosed upper airway disorder for 28 long years.
And I'm her dad, Victor Avis. I'm a third-generation dentist from Staten Island, New York. I went back to study orthodontics. As a general dentist, we don't learn anything about orthodontics. So I went back in 2008 because I wanted to understand what was behind that black box, which they kept so mysterious. I no longer finished a conventional training program. That a mentor of mine who knew nothing about orthodontics said, you need to listen to this guy, John Mew. And I pulled him up on the internet, and I was fascinated. And I said, if his paradigms or thoughts are correct, then what I've learned is actually 180 degrees in the wrong direction, meaning we were holding the upper jaw back so the lower jaw would catch up. And John Mew was saying, we have it all wrong. They're both too far back. It bothered me so much that my wife, Kim, who's here today, said, you need to go. And I found out that John and Michael were doing a course in Purley, England. And so in 2011, I went for the first of 3 trips, almost a week long each time, to England to learn with John and Michael Mew. And I'll tell you that this was the beginning of new knowledge for me, knowledge that would not only change the trajectory of my dental career, but would change Sydney's life for the better. So it's an honor, Michael, to put this program, to be a part of this program, and to join with this bold group of innovative thinkers. I think they're really actually disruptors, good disruptors, to share a vitally important health message.
So what is the connection between an aesthetic profile, including straw jawline, and health? A facial profile that demonstrates a weak, protruded small lower jaw is a profile of a person that is at increased risk for an upper airway disorder. So for those who don't know, an upper airway disorder is a health challenge that is caused by an interference to proper breathing in the upper part of the breathing passage, the nose to epiglottis. When you're not breathing correctly, it's amplified at night, contributing to sleeping issues which impact every area of your life. And airway disorders are not rare. They're pervasive, reaching epidemic proportions, impacting about 1 in 3 people, conservatively.
I'm going to ask you to join me in an exercise. It's easy. If you're able to, you'll raise your hand, please. But as an infant and young child, most of you joining us here today have experienced one or more of the following. So if you're able to raise your hand, if you've experienced any of the following, please do so. If you were not breastfed or breastfed minimally, raise your hand. If you had a pacifier or sucked on your thumb or fingers, raise your hand. If you suffered with seasonal allergies or had frequent sore throats and earaches, raise your hand. Raise your hand if you ate a standard modern diet that included breakfast cereal, rice, pasta, and soft Wonder Bread. Okay. And finally, please raise your hand if you know of a family member or friend who had one or more of these experiences. Now raise your hand if none of that applied to you. There's not a hand that went up. And so for all of you, like me and Sydney, you are at an increased risk for manifesting or expressing a different appearance because of these early life experiences or habits. The features of this appearance are common, so common that we've called them normal, the new norm. And they include a smaller retruded jaw, a longer face, and a more common narrow constricted airway. Craniofacial dystrophy, as Michael coined it. Persons affected are at an increased risk of suffering from an upper airway disorder. This conference is an opportunity to understand that most of us, most modern people, are not only at increased risk for weak lower jaw, but with this change in our appearance, our form, comes an increased risk for upper airway disorders that affect how we breathe, how we sleep, how we function, the quality of our health, and our lives. So how is form related to function and vice versa? Some examples. Birds have wings which enable them to soar and glide. Fish have gills to breathe and live underwater. And humans have a nose for breathing and a mouth, teeth, and descended voice box for chewing, expression, physical attraction, digestion, and communication. You all understand this intuitively. However, I must emphasize that when we alter human form, the consequence is not only a change in appearance, but also a change in our ability to function, our ability to survive and thrive. Humans who did not breastfeed, who used pacifiers or habituated finger sucking, ate a soft processed diet, or suffered with intermittent clogged nose, which represented this whole audience, one of those at least, they will have adopted a habit of breathing through the mouth to survive. This mouth breathing, a change in function, then causes a change in form, a change in appearance. Many people develop longer faces, protruded small jaws, crowded teeth, small nasal passages, nose with humps, gummy smiles, weak chins. And with this change in appearance, facial aesthetics, there will often be a change in function that results in declining health. Signs and symptoms of your mind and body unsuccessfully compensating are things like ADHD, fatigue, exhaustion, diabetes, anxiety, depression, high blood pressure, heart disease, stroke, cancer, and dementia. Yes, I've named all the major chronic diseases, and so many of them are rooted in upper airway disorders. So this is why Sydney and I are here. We want you to know that if your appearance does not fit the Mewing facial ideal of a forward lower face, good posture, and good oral rest posture, of lips together, teeth together, and tongue suctioned onto the roof of your mouth, then you are at risk. Or stated otherwise, the seemingly unrelated signs and symptoms just mentioned are often rooted in a form that narrows the upper airway, disrupts breathing, disturbs sleep, and can deteriorate the quality of one's life and health. The great news, as Michael said, is that when you improve the appearance, the form, then function and health can improve as well.
As my dad mentioned, symptoms of airway disorders often look like common health issues we've grown accustomed to. In my case, the signs were there from a young age. A perpetually stuffy nose from allergies, leading to chronic mouth breathing, which led to dental crowding. I was exhausted without fail every day. It didn't matter the time I went to bed or the hours of sleep I got. When I woke up, I felt like I hadn't slept. I had a long face, dark circles under my eyes, and overall did not look healthy. Doctor visits resulted in Band-Aids or temporary fixes like braces, and stating I would grow out of my other issues. As I got older, school became my biggest challenge. I worked hard, and I mean hard, for my B's and C's. I went to extra help. I had tutors. I studied and studied. I did the readings, but every day I felt like I was starting over. I couldn't remember what I had read the night before. I would sit down to take a test, and I knew that I had studied this, but I couldn't get the information out. It was all extremely frustrating, and after some time, I just accepted that I wasn't smart and went through life believing I was less than. During this troubling high school time, anxiety started kicking in. Then came the panic attacks. Throughout college, it was a lot of the same. Next, I was diagnosed with hypothyroid disease. I had constant gut issues, and my mental health challenges continued. After graduating college, I became more deeply committed to a healthy lifestyle. I was active, vegan, meditated regularly. I even studied yoga in India, but there was still something missing. I still never felt well.
Early on, my response as a parent and dentist was regrettably and sadly limited by my own awareness and education. I failed to see the interrelationship of symptoms despite all the signs being there. My dental training and perspective led me to refer Sydney for orthodontic treatment at age 8. Then at age 10, we saw a pediatric ENT not far from here, and we enrolled tutors to help with learning during high school. Braces, inhalers, and academic support were all on board. What I did not realize is that we were treating symptoms downstream, symptoms that were interconnected, and ineffectively. Sydney was pushing through and seemed okay, but she was not. What I wish that my wife, Kim, and I knew when Sydney was born, I wish that I understood that breastfeeding is a key to good health, not only because of the immune system, nutrition, and bonding benefits, but also because breastfeeding encourages forward-wide facial growth and development that causes a better airway, improved breathing, and better health. Furthermore, I wish that we were aware to assure that Sydney could breathe through her nose, and that weaning her on tough-to-chew, non-processed foods would develop a facial form that supports good function and good health. In short, what Kim and I did not know, but that you all know now, is that breastfeeding, nasal breathing, and baby-led weaning is the natural way to develop a facial aesthetic form that supports good health. It's that simple or that difficult. So how does mewing fit into all this form and function discussion? Mewing is a form of exercise and therapy that is based on the science of myofunctional therapy. It is taught and practiced to help to retrain good neuromuscular habits, develop facial muscle tone, improve body posture, and improve oral rest posture. Muscle tone can change appearance and can also influence positive structural bony changes. In addition, nasal breathing can improve airway function, sleep, and overall health. So the journey with mewing is certainly going in the right direction, and I affirm each one of you that have embarked on that journey that you are doing the right thing. However, depending upon the person, mewing, as Mike Mew himself just said, alone may not be enough to achieve your desired facial aesthetic changes or treat one's underlying chronic mental and physical health problems.
So one of the very first therapies that my dad encouraged were exercises to improve my oral rest posture and facial muscle tone, along with nighttime mouth taping. However, my symptoms persisted. Early on, doctors seemed to doubt the depth of my despair and reassured me and my parents that I'd be fine. What they saw was the image of the kid on the left, a mediocre student, decent athlete, someone making it through. Although I hit it pretty well, I felt like I was constantly playing catch up, and this became ever more challenging to maintain. I saw doctors about my exhaustion. I saw doctors about my stomach issues. I saw doctors about my anxiety, but no one ever connected the dots. My first sleep study at age 25, I was told it was mild sleep apnea, and again, I should be fine. I was also misdiagnosed with narcolepsy. The sleep physician recommended medication, amphetamines like Ritalin, Vyvanse, Focalin to keep me alert. My reality was that I was the person on the right. That is not the face of someone thriving. It is the face of someone merely trying to survive.
As a doctor, parent, and airway expert, what have I learned through this experience with Sydney? And I say this with great humility. Listen to and observe the symptoms, whether they be your own or that of a loved one. Tests are used to better understand your signs and symptoms and the depth and breadth of the problem. However, the test can be faulty, and digging deeper is often required for an accurate diagnosis. For example, though Sydney reported feeling tired, cranky, and school was extremely challenging, her sleep study indicated only 7 interruptions to sleep per hour. She was labeled as having mild apnea and dismissed as if the problems and her symptoms were in her head. Listening to and trusting Sydney, I did not accept mild as a diagnosis, and we did a deeper diagnostic search. We sought the opinion of an ENT who did a drug-induced sleep endoscopy. Good luck getting that covered by your insurance. Dr. Zaghi said it was one of the worst airway collapses that he had ever seen. Sydney was finally, for the first time, affirmed. Further, we engaged in neuropsychology testing and confirmed that Sydney demonstrated significant deficits in short-term memory, problem solving, and executive function. In some of these areas, Sydney was in the lowest 5th percentile. And post-treatment, by the way, in every area, Sydney went up 2 to 3 standards of deviation change, which is unthinkable in these testing by neuropsychologists, such that the test was regraded second time and third time because the results were so amazing. At last, Sydney received an accurate diagnosis of upper airway resistance syndrome, which explained her severe symptomology, and double jaw surgery was recommended. The message is that if the tests do not support the patient's symptoms, then do not assume that the patient is wrong. Rather, it requires a deeper level of investigation. Airway disorders and disrupted sleep can be caused by multiple factors, and they can be complex to diagnose and treat successfully.
I am an example of how the form follows function. My function was way off because of my severe allergies to dogs growing up, and we had 2 dogs. My nose was always clogged, so I became a mouth breather. I was born into a house with these allergens and knew nothing else. I was breathing improperly, my lips almost never touched, my tongue hung low, I often drooled, and I was completely unaware that this would determine the trajectory of both my physical features as well as be the root cause of my physical and mental health struggles.
The tropic premise, which I had never heard of until I met Mike Mew. Lips together, tongue suction to the roof of the mouth, and teeth lightly touching. This affects facial growth and development, appearance, function, and health. Sydney explained that she could not get her lips together as her nose was frequently clogged from an allergy to our dog. Unfortunately for Sydney's health, lips together posture is necessary for nasal breathing. And nasal breathing serves to filter, warm, and humidify our inspired air, increase nitric oxide, and prevent overbreathing. This all improves oxygenation, immune function, blood supply, and health. In short, nasal breathing improves function for every organ system, including our brain, nervous system, and heart. In addition, Sydney could not suction and posture her tongue to the palate, as this would block her mouth breathing, which had become essential for survival. Again, like Michael said, if you're not able to do it, if it's uncomfortable, you're not going to keep your lips together and your tongue suctioned. And so Sydney, without resting her tongue to the palate, the roof of the mouth soon developed to become both narrow and retruded. In fact, it was too narrow and retruded to accommodate her tongue. Having become further habituated, Sydney's mouth breathing ensured that her airway disorder, downward spiral, would continue. Tongue to the roof of the mouth creates a healthy light pressure on the cranial bones, and this affects the appearance of our face and the size of our airway. In fact, light pressure over time is how orthodontics works, to move teeth and remodel the bone around them. It is why people who have a bent posture develop a kyphosis or a humpback. When the tongue rests on the roof of the mouth and positions itself during rest posture, as well as during a proper swallow, which happens on average 1,000 times per day, then the palate develops wide and forward. The palate is also the floor of the nose, so as the palatal shape and position improves, nasal space increases, and the upper airway enlarges, enabling improved airflow and more efficient breathing. The third element of proper oral rest posture is teeth lightly touching. The occluding of teeth ensures that as the upper jaw is developed forward, the lower jaw will follow. The result will be a beautiful facial profile, a well-developed airway, and a form that encourages restful, reparative sleep. However, Sydney could not effectively keep her teeth in light contact, as she could not nasal breathe, and she had insufficient room for her tongue when the teeth were lightly touching. Thus, as Sydney would hang her mouth slightly open for both breath and tongue space, her upper and lower jaws became both small and retruded. Anything that interferes with proper oral rest posture, nasal breathing, and proper swallow, speech, and chewing can affect both form and function, appearance and health. Many of you know or will learn today the signs or deficiencies emphasized and addressed by mewing, facial yoga, or myofunctional therapy. However, let me share some less known facial features or experiences that should grab your attention because they're so common. These very common signs and symptoms put a person at risk for an upper airway disorder and the downstream effects we have previously mentioned, such as ADHD and fatigue and high blood pressure and heart attack and stroke, and anxiety and depression, which plagues particularly our younger generation. You are at risk for an upper airway disorder if you have crowded teeth. You're at risk if you had or need orthodontic treatment, because your teeth don't have enough room for your tongue, so they're correcting the misalignment but not the root cause. If you had frequent sore throats or earaches as a child, if you grind or clench your teeth, if you snore, if you awaken with a dry mouth, if you had oral habits, past or present, if you have a thick neck or are overweight, and if you have seasonal environmental allergies, all of these conditions increase your risk for an upper airway disorder. So we have discussed the relationship between appearance and health. We have described signs and symptoms for an airway disorder. And Sydney has shared her story to help elucidate the relationship of her breathing-related sleep disorder to serious health and quality of life conditions. So what do you do if mewing is not enough? Well, first, find an airway-educated doctor to facilitate your journey to better breathing, sleep, and health. Get a sleep study. Once there is a determination that a constricted upper airway is the problem and a diagnosis determined, then treatment options can be discussed. The good news is that there are many treatment options, combinations of therapies, and opportunities for improvement. However, the road to overcoming airway disorders can often be tortuous, and the journey requires good leadership, perseverance, and personalized precision health care. Soft tissue swelling and enlargement into the upper airway can occur from tonsils and adenoids, acid reflux, postnasal drip, weight gain, and mouth breathing. Thus, each of these areas may require management and may require different specialists. If protruded small jaws are the problem, as in Sydney's case, this growth and development problem can be definitively resolved as an adult and aesthetics magnificently improved with double jaw surgery and orthodontics. This surgery can now be provided with precision and less morbidity or risk in only 1 hour. Sydney's jaw surgery just 3.5 years ago took 7 hours, and it now can be done in 1 hour. Depending upon the cause and area of collapse, upper airway disorders might also be well managed with a single therapy or a combination of therapy, including nasal and tonsil and adenoid surgery, myofunctional therapy, positive airway pressure, which most people know as CPAP, oral appliance therapy to bring the lower jaw forward at nighttime, hypoglossal nerve stimulation, most people know the word Inspire, which also brings the tongue forward when airflow decreases, non-retractive airway-minded orthodontics, and weight loss strategies, including new medications. In my opinion, to achieve the most transformative aesthetic improvement and health benefit as a grown adult, precision double jaw surgery, advancement surgery with orthodontics and myofunctional therapy is the gold standard. That will get the job done in 1 hour. It does not negate the need for myofunctional therapy. It usually has to be done in conjunction with some simple orthodontic care, but the advances in double jaw surgery are incredible. Some of you listening today are interested in aesthetic change, others in a solution to your health challenge, and others to unlock the key to improve sleep. For all of you, we set out to connect the dots and help you understand the profound interrelationship between facial aesthetic appearance, airway disorder risk, restful reparative sleep, and downstream health impact. The connection between a weak jawline and ill health risk should not be taken lightly. The health effects can be serious, and the earlier in life that there is recognition of craniofacial dystrophy, the more likely is the opportunity for a cure or successful management.
I was lucky enough to get double jaw advancement surgery, like we mentioned. It brought my top and bottom jaws forward and opened my airway. I also had my deviated septum fixed and turbinate and adenoids reduced. I paired this with myofunctional therapy and continue to work on my oral posture daily, including taping my mouth while I sleep. For me, this surgery was life-changing. I looked like a completely different person, to the point where I'd run into neighbors and old friends, and they didn't recognize me. However, although I'm pleased with my new appearance, I'm thrilled by the way I feel. Successfully treating my airway disorder has changed my life. I feel like I got a new chance to be the person I knew I was, but I couldn't access. I have energy right from when I wake up until I go to bed. My brain works in a different way. The fog is gone. Clarity is there. My anxiety has improved immensely and can now experience life to its fullest. In my journey, I was fortunate to have a dad who refused to accept my symptoms as mere nuisances. As both a dentist and a perpetual learner, he delved deep, pushed back against dismissive doctors, and fought for answers. The Airway Revolution Foundation was born from that unwavering commitment to advocacy. I was fortunate enough to find a solution that worked for me. Now it's my turn to be an advocate for those still struggling. The Airway Revolution Foundation is a nonprofit leading a grassroots movement. The movement will advance education in dental and medical schools and improve access and quality of care surrounding airway disorders. But it doesn't start with us, it starts with you. This is a revolution of the people. We need you to join this movement to show just how many people are affected by small, protruded jaws, poor facial muscle tone, and a risk for an upper airway disorder. Through the power of a large public voice, we can improve upper airway disorder care and outcomes.
I graduated dental school in 1987, and there was no education devoted to recognizing signs and symptoms of airway disorders and the role of dentists or physicians in diagnosis and treatment. Forward 37 years later, and medical and dental schools are still not teaching our future doctors about the diagnosis and treatment of airway disorders. To change the status quo and to make a difference in the lives of millions, it will take the unified voice of a large number of people demanding change. 7 years ago, we prospectively began filming Sydney's journey. We felt that if millions saw that improved breathing and sleep could make a huge difference in the quality of one's life, then millions unaware would seek care. We then expanded to share the stories of other people, young and old, who found airway disorder treatment was the key to living a better life. This 3-part documentary series will be ready for distribution in 2025. But realizing this was not enough, 3 years ago, as Sydney mentioned, we founded the not-for-profit 501c3 Airway Revolution Foundation to improve quality and access to airway disorder care for the hundreds of millions who suffer. To fulfill this mission, we need to increase public awareness, influence change in doctoral education, increase government funding for university-led research, and influence Medicare and Medicaid reimbursement policies. We need you to help make our voice count. By following us on social media, visiting our website, you are joining our grassroots movement and helping our foundation to spearhead meaningful change, a true airway revolution. Thank you.
Thanks.
Bill says stay up here. So can mouth breathing cause stuffy nose? So I think it's circular. Mouth breathing causes disuse of the nose, and disuse of the nose will cause, like with any structure, atrophy. And typically the disuse of the nose, though, comes from inflammation. And so I think they're intimately tied together. And I'd also say that if you think of the end point of the question is, can you get to nasal breathing without fixing the nose in some way, I think that's difficult. So you can retrain nasal breathing, but you have to have control, whether it be of the underlying cause, which could be the allergies, or it can be already enlarged anatomical structures or deviated septum that makes nasal breathing impossible. So I think it's the chicken and egg question is always a difficult one to answer, but the solutions are more clear. You have to create a nasal passage that allows airflow, and then you have to retrain through neuromuscular reconditioning and habit retraining nasal breathing. Well, I promise that today there will be people that speak about it, but the answer is yes. A proper swallow should be done by posturing the tongue up on the roof of the mouth, and there should be there should be no noticeable involvement of the lips and the facial muscles in that action. And so oftentimes we'll check it by putting in retractors to pull the lips back, put a little water on the floor of the mouth, and have the patient separate their teeth and ask them to swallow, at which time we duck because the water usually comes pushed right out because they're so used to involving their teeth and lips in the swallow, and that is not correct function. Thank you, Bill. Thank you, Michael. Question up front, if I can.
What do you think was the initial cause of all the problems? Did she have tongue-tie, why?
Yeah. What was the initial cause of Sydney's problem? And Sydney has a great handle on it.
All right, I'm not medical, but my initial problem is that I had severe allergies to the dog, and I was born into the house, the dog was already there. They weren't getting rid of the dog. So I never even really had a chance to breathe through my nose because I was so stuffy, and at that point we didn't know the importance of nasal breathing, so we didn't put anything into action to really make sure that was happening. We just thought, I'm breathing, so she must be fine. But the reality is I was mouth breathing, and it became a habitual problem, and then I had no use of my nose because I pretty much never used it.
No tongue tie in Sydney's case. We need to move on. Okay, I'll pass it along. Our next speakers, Bill. Great.
So can I introduce Tash? Tash, your presentation is on Alpha appliances. Fantastic. So thank you very much.
So I am Dr. Tasha Turzo. I'm an osteopathic physician. In the United States, osteopathic physicians were medical physicians. Outside of the United States, osteopaths are more kind of like our chiropractors or PTs. I've been in practice. I need to do to help that? Okay, so as we're getting this tech, let's see, I think I'm gonna leave it here. Well, okay, hi everybody. My name is Dr. Tasha Turzo. I'm an osteopathic physician. I've been teaching in the world of cranial facial dysfunction for 27 years. I have watched dentists have their minds blown open by the concept of function. I have watched them start to look underneath the tongue, watch the revolution of the tongue function happen. I have watched dentists realize that the dental occlusion affects the place behind the tongue, now AKA called the airway. I have watched dentists now become airway specialists. It has been a phenomenal, incredible experience to watch all of this unfold. And there is a revolution happening, and it starts with the people, because all revolutions start with the people. So when I wrote my book about the ALF approach, which I have been teaching in this world for, again, 27 years, been practicing for 30 years, I wrote it to parents. Because as we just saw, parents will make the change that's needed to be made for their children. So this is the book, The ALF Approach. I wrote it as a resource guide for people to be able to look up what is the ALF approach, what causes this syndrome, let's call it crooked teeth syndrome, right? So here's a keynote. The position of our teeth are a symptom of our soft tissue influences. In other words, how we swallow, what the resting position of our tongue is, and how our face contracts dictates the position of a tooth. That's been revolutionary also, because dentists are still saying that it's genetic. It's not genetic, it's epigenetic, right? I'm sure all of you know what epigenetics is by now. So the ALF approach, the ALF is a light wire. It's made it to go behind the upper and lower jaw, the upper and lower teeth, and it is taken out and adjusted once a month by a dentist who is trained in using the ALF approach. It's called an approach because it's not just about the light wire. As we all know, the light wire is augmenting normal growth and development of the upper and lower jaws. It is also placing the tongue up in the palate, so you're walking around with a myofunctional device 24/7. It's also a cranial osteopathic device because of the certain kind of metal, a yellow alloy wire metal, that it actually, what it does is it augments normal cranial motion. So what does this mean? When we put an ALF appliance in someone like Sydney when she was little, the nose drains because we get the cranial motion moving and the temporal bones move. And that's the subtle motion within the cranium that causes not just a brain drain. That's how, do you guys even know that our brain actually has lymphatics and it drains? 8 hours of sleep at night, that's when we drain our brain. And what creates that during the day and the nighttime is a subtle expansion, contraction of the temporal bones. That's also what drains our sinuses and our nose. Another important point, just to follow up from the last talk, when someone comes, so I'm also a functional medicine physician, and I just recently wrote a chapter in Dr. Neil Nathan's new book about mold and microtoxicities, and I tie in craniofacial dysfunction and the difficulty with detoxification. When there is compromise to the cranium, to the dental occlusion, to the back of the neck, the vagus is affected. And I write this in chapter 6 of my book. It's like a whole new perspective on TMD. When the vagus is compromised, the gut's compromised. When the gut's compromised, nasal's compromised. So I never see a child and believe any of the allergies that have to do with environmental allergies. There's basically gut. Gut is inflamed, thank you very much. Gut is inflamed, nose is inflamed, right? So what Sydney needed was to see a physician like myself who does functional medicine so I can work up what is going on with her gut. And that's why I'm passionate and working so much in the world of mold and microtoxicities, because that is becoming more and more prevalent for us. There's a whole revolution happening in that world. So let's talk about swallow. Because mewing, we talk a lot about tongue up. That's the resting position of the tongue, and oh, so important. But what about the swallow? Because it's the swallow. Did you guys know that an anterior tongue thrust swallow causes GERD? Right? That tongue goes up and forward every single time. That pulls up on our stomach, our entire GI system, right? So tongue ties, anterior tongue thrust. restrictions underneath here where the tongue has to go forward, that causes GI symptoms. Infant swallow. I'm not going to go through this in detail, but it's actually really, really interesting. There is a neurological integration of the tongue swallow specifically for nursing. It's guided by the seventh cranial nerve, which innervates the face. The tongue goes forward, hits the lower lip, you get a contraction, it goes back. It goes forward, it goes back, it goes forward, back. What's lovely is that we have a jaw joint that's flat on the top, right? And it's made to be able to go forward and back, forward and back, forward and back. But we start getting teeth coming in, we all of a sudden have a different, it's a neurological integration. It's an actual neurological reflex that happens. When the teeth touch, bam, the tongue's supposed to go up to the roof of the mouth. If something is disrupted in our children at this time, when we're going through a transitional swallow, what happens? They don't get that integrated neural reflex where the tongue goes up to the roof of the palate, right? And then the tongue starts to go up and back. It is not supposed to go forward. If it continues to go forward, what happens to the jaw joint here? It's supposed to be a ball and socket joint. It becomes flat. I've looked at hundreds of CBCT scans, which are kind of like an X-ray scan of children. We see children 6 years old who have a flattening of the condyle, of the mandible, and that's because of their anterior tongue thrust and or tongue tie. They're two different things. They can go together sometimes. So the mature swallow is when the teeth hit, the tongue goes to the roof of the mouth, and then it goes up and back. So let's all check it out. I want you all, well, actually, let me just say this. What happens when we have this functional resting position of the tongue and the up and back swallow, we have nasal breathing, is we grow our face. It's the function that grows a face, right? And why did I get so involved in this ALF world was because Dr. Nordstrom, who was the founder, creator of the ALF, started coming to my office once a month 30 years ago. So we have been working with patients together for 30 years now. And then I had another dentist from the East Coast, Dr. James Bronson, had him come out to my office. He used to fly out every single month to see patients together. It's because we created a device, an appliance that mimics physiological facial growth and development, okay? Think about that. What grows a face is tongue posture, tongue swallowing. So if we want to use a dental appliance to recapture lost facial growth and development, let's use one that's a biomimetic tongue, something that's shaped like a tongue, something that activates the cranium like a tongue, and even better than that, actually augments cranial motion, which creates the sinus drain, the ear drains, the brain drains. The tongue goes up, it pushes out, the buccinator contracts, brings it in. That's what creates the arch development of our tongue. Has anybody wondered why our teeth are shaped in an arch? Because the tongue is an arch, right? So what do we want to do when we're looking at this from a physiological perspective, a bio-integrated approach? We want to use a dental device that activates the palate like the tongue. Everyone, let's do this. Take your fingers, slightly bring your cheeks apart, and swallow. How many of you can do that without using your facial muscles? Oh, great, great. Yes? How many of you got spit flying out, right? Right? Or how many of you feel your tongue touch the back of your teeth? So that's the other one. Yeah, yeah. So I had an anterior tongue thrust, and I also had neck pain for years and years. And I'm an osteopath. It's not like I haven't been treated a lot. I would be treated, neck pain would go away, the neck pain would come back, and I'm like, we are missing something, right? So I sucked my thumb, pretty sure it was this one, for a long time. It was great. And then what happened was I had an anterior tongue thrust because my tongue was used to going forward in that sucking motion because I had a prolonged sucking motion with this thumb. What happens when our tongue goes forward? What happens to our neck? Our neck goes forward. We do this 1,000 to 3,000 times a day when we swallow. We have a head bob. And what does that do? that overactivates the anterior cervical muscles. What does that do? These are called the scalenes. The scalenes get tight. The scalenes attach to ribs 1, 2, and 3. What does that do? Pulls up on the ribs. What does that do? Creates a mild thoracic outlet syndrome. So cold hands, recurrent tendinitis and bursitis in the arms. It's a lack of flow of blood, a lack of neural integration that happens because these muscles here are too tight, right? So what's happening? You go to the chiropractor, you're getting crack, 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 crack in the back. The problem's in the front, the problem's with your swallow. So how we swallow affects our entire body all the way down. And what greater means of understanding that than to be an osteopath who understands how structure and function are reciprocally interrelated. That is where this all started. It started with osteopathy in America, probably about 150 years ago. The basic tenets are the body's a whole functional unit, so you can't do something to the mouth that's not going to affect the feet. It's completely integrated, right? That the body has an inherent capacity to heal itself. When we put a Band-Aid on, as a physician, if I put a Band-Aid on someone, I'm not healing them. I'm creating the environment for them to heal. And that's what we're doing. And the third one, structure and function are reciprocally interrelated. They're interrelated. One creates the other. So when you start looking at the teeth and dental occlusions from the point of view of tongue dominant, tongue function creating the structure, what do we start seeing? We start seeing crooked teeth syndrome is a consequence of myofunctional facial craniofacial dysfunctions. So let's treat root causes. Let's treat root causes. Let's figure out. Let's not settle for some environmental allergens and some children who can't breathe through their nose. No, it's a gut issue. Let's figure that out. Right? So now we start understanding that teeth are being positioned by the tongue and the tongue swallow. And this happens when probably we have a tongue tie, and that tongue is held down low and cannot even get up, right? So you see the sides are caving in. And what would happen in traditional orthodontics, not with this case, but say another case with crowding of teeth, is they put braces on and push everything back. Any sort of pressure on the teeth going back, there's a reflex that happens in the jaw. It causes the mandible to pull back. And that's why we start seeing TMD when we've got the braces on. When we have anything that's retrusive, that causes jaw joint problems. And the face grows down and forwards. So let's continue with this forward motion and forward revolutionary movement to augment intraoral volume and create and treat craniofacial dysfunction. So form follows flow. This is what we're saying is craniofacial development is developed by the function. It's the function of breathing, it's the function of chewing, it's the function of swallow, it's the function of resting position. So intraoral function is of pivotal importance for a healthy, for health in general. I have so much to say about this. It's very challenging for me to do this in 20 minutes. Like when I have an online course that's 11 hours, highly recommended. I have the book. I have a mentorship program where I meet with dentists all over the world every month for 2 hours, and we discuss cases, and we look at these cases of how can we optimize. Oh, 5 minutes? Wow. Okay. Let's see how fast I can go. So this is the Alpha Appliance. It's a biomimetic tongue. Here are two very important facts. We are missing this big time. Children, babies, when they are born, our bodies are becoming, bone density is becoming less and less, which means that cranial compression is becoming more and more. If we put together our osteopenic, which means low bone health, let's say, and interventions like Pitocin, what do we have? A lot of cranial compression. So this is an infant skull, and you can see here, I don't know if you can see, you can see these areas where there's opacity, which means that that's fascia. If you flip it over and look on its back, this occiput, which is the base of the head right here, is actually developed in 4 different parts at birth. And the reason why is because all of these bones up here can float and they can morph and change so that we can fit through the canal that we need to come through. But what can happen is you can get a shift in the base of the cranium, and you get a fascial strain that affects these four very, very, very important cranial nerves. Cranial nerves 9, 10, 11, and 12. Anybody know what 12 is? The hypoglossal nerve. Did you know the hypoglossal nerve goes through an open space between these four pieces of the occiput? And at birth, if there's a shift in the base of the occiput, it can compress and impinge that hypoglossal nerve. That's why these babies can't nurse. It's not always a tongue tie. If you have a floppy, low-lying tongue like this, and you've had cranial compression, certainly if you have a diagnosis of plagiocephaly, there's a compression at the base of the cranium, and that needs to be treated. So the cranial osteopaths know how to treat these babies. That space that the hypoglossal nerve goes through, that's an open space, that ossifies into a canal at 8 to 9 years old. The shape of that canal is going to be dictated by the position of those four pieces of the occiput. There's a hole. You guys see my pointer up there? Okay, this is called the jugular foramen. This is where cranial nerves 9, 10, and 11 go through. If there is a compression rotation at the base of the cranium between the occiput and the temporal bone, you're going to have a change in the size of that foramen, of that hole, which can again cause a fascial impingement on those cranial nerves. That is going to affect your swallow and your breathing. So let's get into our nerves, right? Let's treat these babies at birth. Let's take it. One of my biggest passions is to teach the dentist to take birth histories. They're a little nervous about it first, but then they get the hang of it. This is another very important thing. When the tongue goes up and back, okay, many people get the front of their tongues up, but the back of the tongue needs to come up. That hits a joint in the middle of the head called the sphenoid-basilar symphysis. It's a cartilaginous joint in the middle of the head. We have 3 joints in our head, one in the middle and our 2 jaw joints. The one in the middle becomes less cartilaginous 28 years old. But until 28 years old, we have motion in the middle of our head. And we need that for our brain drain. So when you get the back of your tongue up, when you all say guh, 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 you're kicking it up. You're doing a push-up in the back. You're going to cause an opening in your cranium. The body is not hard, solid. The body has flexibility and motion to it. We are connected from the top of our head to the bottom of our toes with fascia and fluidity. So I always talk and teach about Gumby because Gumby doesn't have anatomy. Gumby only has physiology, which is actually what we actually are. We can talk about joints, and there are joints, but the joints don't limit the continuousness of our integration. So if we're seeing someone who's taking our body apart, just treat a joint, they're missing the big picture. When we have injuries, our body gets compressed. Our body is something called a colloid model, and it has a property called thixotropy, which means that we respond as a solid or liquid depending upon how we are interacted with. So if someone comes out and gives me a great big hug, there's a melting. If I fall out of a tree, bam, it's a hard compressed. That compression stays in the body sometimes, right? And that's what I feel with my hands. I feel the body as a fluid, all fluid, and I can feel strain patterns, not myself, but osteopathy. And we feel this compression of the tissues. And when there's compression of the tissues, there's restriction in the fascia. So this is a delivery of an out. This is a 4-year-old who was about to get his tonsils taken out. So this is 3 months later. You can see here, that's grade 4. Here is not. This kid did not get his tonsils taken out. This is 3 months of an appliance that was very comfortable for the child. This is a same patient, rapid palate expander. Mom was like, this isn't working, I'm done. And the dentist said, you're done with the rapid palate expander. Can you see here? There's red. Red means no error. So this is a finished case of a rapid palate expander. Same patient. 5 years later with an ALF, do you see? There's now green, which means they can breathe better. This is what the dentists are missing. Do you see this neck and this neck? Our necks are not supposed to be like this. These are called militant necks. And it's tight because the scaling muscles are over-pulling, and this human being had lost their cervical lordosis. That goes all the way down the body. You lose your cervical lordosis, you lose your lumbar lordosis, right? There's no need to be so aggressive in a non-physiological fashion. We want to maintain our cervical lordosis. This is a 57-year-old with palatal development in 5 months with the ALF. You see that there's a 3 millimeter and a 4 millimeter change. 3 millimeter in the front and 4 millimeter in the back. This is used primarily, this is activated primarily by the tongue. So once again, we're integrating the primary dysfunction and opening up the palate at the same time. So you don't want to put something across the palate when you're trying to actually open it up, right? All the other appliances keep the tongue low. Why not use an appliance that doesn't go across the palate and brings the tongue up, and you've got 24/7 myofunctional therapy, 24/7 osteopathic, as well as orthodontic orthopedic. So I have lots more to say. Please check out my online course if you want to go deeper into this. It's 11-hour on demand all the time, and my book also is available on Amazon. Thank you so much for your time. Long face syndrome is definitely an issue, and I think of it as, you see my hands here, you're restricted in the back, which is the space behind your tongue. What is nature going to do? It's going to open up in the front. So it goes like this, right? So does the maxilla go downward? The maxilla certainly can go downward. The mandible, the actual condyles, and the ramus start to change. Everything is adapting towards airway. So everything in the upper face is starting to come down, the mandible is starting to come down, and it needs intervention. And the sooner the intervention, the better. So when I see my 2-year-olds in my practice and my 3-year-olds, and I start intervening right away with everything that we just talked about. I'm looking at gut health a lot. I'm looking at nasal breathing, everything. It's the whole approach. It's not just an appliance. It's got to include functional medicine. It's so interesting. It's impossible to answer these questions because you have to assess the whole individual. I can tell you that I've seen impactum wisdom teeth improve with the Alpha appliance. I have seen that. And why? Because we're actually moving everything forward and a growing space for the wisdom teeth to come in. Posture, it depends. It depends on what age. If we're talking like a teenager and they start making all those changes in their life, including eating better, postural changes, tongue habits, making sure the tongue has its full range of motion, it's possible. Oh, good Lord. Can I have another 12 hours? There's so much. It's always, we always have to look for root causes. That's what's really important. So why? So if I see a patient in my office, I'm like, why do they have TMD? What happened? I have to take a total trauma history, right? It could have been an injury at birth. It could have been an injury at 2 years old. It could have been how they ate. It could have been what they ate, right? It could have been a tongue tie. It could be forward posturing. It could be a whiplash injury. I cannot tell you how many patients have TMD who are in a car accident. We think of like cervical injuries. Well, the whole entire mandible gets whiplash too. So I do regenerative injections, PRP, prolotherapy, now onboarding exosomes, and I do injections in the jaw joint. You can't have muscle-skeletal integration if your joint's not functioning, right? So all this stuff about, doing our myofunctional therapy, wonderful. But if someone has TMD, I don't send them to the myofunctional therapist first. I have to stabilize that jaw. It's kind of like asking you to go to PT when you have like a meniscal tear. It's not going to happen. Your muscles are going to compensate for that compromise to the joint. Yes, thank you.
I hope people don't mind that I keep the slides up. It helps me keep track of what I'm talking about. Otherwise, I will just ramble. Yes, thank you. So the previous discussions that we've had, the talk by Airway Revolution and the talk by Tasha Terzo, I want you to keep those in mind as I talk. There's a continuity to the discussion here, and I hope you can see what Mike's trying to do as well. Trying to bring all of these speakers together because we have pieces of the puzzle. In the modern age, essentially, jaws are undergrown, skulls are undergrown. We don't have a definitive cause yet. We don't have a definitive cure yet. But coming together like this, you're going to see how the puzzle pieces fit together. So I want you to remember everything you've heard so far. This is a revolution. It starts with everyone here. It starts with the patients. It starts with the practitioners. And I want you to keep in mind all the different parts of the skull. Okay, we're going to be working with that. This is an interactive presentation. I will be asking you to do stuff. So anybody here and anybody at home, if you have an injury or you have some reason that you can't do an exercise, you simply don't do it. Okay? It's not a very intense exercise, but what I'm hoping for is by the end of this session, you should be able to perform my method on yourself and take it home with you and continue to practice it and improve on it, okay? Everything we've been working on, the jaws being undergrown links in to the rest of the skull also being undergrown. The back of your maxilla connects into the palatine bones. Those connect into the sphenoid. Those connect into the temporal bones. So if you want movement anywhere, you're going to at least need a little bit of adjustment somewhere else. Maybe a little bit of adjustment and maybe a lot of adjustment. Okay? So the typical outcomes with what we're doing, what I'm going to try to get for everyone here, with whole body breathing, is that you get cranial movement and adjustment. You get improved nasal breathing, and you get an unfolding of your posture. Form follows function. The function that you are doing all the time, 24/7, is breathing. You're always breathing. And so any issues with your function will show up in the breathing. So let's practice. Can everyone feel the breath in their torso? When you breathe in, I want you to feel, can you definitively feel my chest is moving, my abdomen is moving, wherever you feel it the most. Okay? Even though I keep talking, even while I'm talking, this entire time, you're going to just continue paying attention to the sensations of your breath. So feel your chest move, feel the belly move. What I want you to see, if you can notice, is when you breathe in, does your posture slightly straighten up? Very slightly. And when you breathe out, it might collapse a little bit forward. And then on the inhale, opening up again. The next thing I would like you to try is to take your palms and have your palms facing upwards on your lap. And notice, where do you feel the breath when your palms are facing upwards? Very good, very good. And then if you flip your palms to face downwards, is there any difference in where it is? And now, if you were to ball your hands into a tight fist, hold your hands in a tight fist and continue breathing with your fists tightly clenched. And then when you let go, you just open up, see if there's any difference in the breath. This is all experimental, right? What is the reason for this? As I said, this is a continuation of previous talks, right? You have connective tissue that runs through your whole body. Runs into the hands, runs into the head, runs into the feet. And so as we're trying to do correction of the jaws, correction of the skull, we're trying to correct the whole body at once and see how it connects together. Okay? So as I continue talking, just continue experimenting with your breath. Continue feeling, please. This talk is titled Cranial Sacral Breath Work because that's the main interest here, really, and that's to get the airway open. This is really where the issues really show up, and they become deadly. They become life-changing when they show up in the head. So what I would like you to try is rotate your head forward. Just slightly rotate your head forward, and I want everyone to know that your head does not attach to your spine at the back of the head. It attaches underneath your ear. Okay, this is where your spine attaches to the head. So from that spot, just rotate your head slightly forward and take some deep breaths. And I'd like you to see if you can notice on a deep breath, if you can feel your head rotate slightly. There's no imagination here, so if I say anything and you can't feel it, don't imagine, okay? Just can you definitively, if you rotate your head slightly forward and take a deep breath, can you feel any rotation or pull on your head? Now, if you were to allow your head to come backwards, and take a deep breath in, can you feel anything on your jaw? Can you feel your jaw move at all? Any forces on the jaw? Very good. And now we're going to try the same thing left and right, okay? Lean your head over to the left, take a deep breath in, and see if you can feel any forces on your head. Same thing over on the right. And now you can go back to neutral, and I want you to see if now that you're back at neutral, and you take a breath in, continue breathing, can you still feel any of those forces? Maybe subtly. Can you still feel any of that happening? And a lot of the talks we've been doing is that what we're working with to fix the teeth, to fix the jaws, to fix the body is subtle force. Not heavy forces, subtle forces, grams of force. So I'd like you to see if you can detect any of the force when you breathe in. Is there still a force on your head, on your cranial bones? It takes practice, it takes proprioception. A lot of people will get it right away, but I guarantee you will get it. I guarantee if you work on it, you will get it. Now, the interesting thing about the forces that are generated here is that your sternocleidomastoid muscle generates a little bit of force. Scalenes generate force. Your trapezius muscle generates force. Cranial sacral therapy and cranial osteopathy. So there's a quote at the top here. Sutherland, beveled like the gills of a fish. He noticed that the temporal bone seems to overlap the parietal bone in a way that is to cause movement. It almost seems like it's supposed to have some movement there. And if you look at the way that the neck muscles the accessory muscles of breathing attach into the head, they attach in a way that the force vector generated by them would be pretty much the exact same vector that's described in cranial sacral therapy or cranial osteopathy. Now, you can imagine that if you are breathing, as you continue to notice while I talk, the breathing might not be completely symmetrical. Some parts of your neck might be more active than others. So if the force generated here is improper, that's thousands of repetitions every day of slightly imbalanced force. Could pull you into a torsion pattern. Remember in the last talk we were talking about torsion patterns. So your torsion pattern would go into your skull through this neck musculature, through the fascia. Now, that's on the outside of the skull. Essentially all the neck musculature going around the back, going around the sides, pulling the head open just slightly on every inhale. Now on the inside of the skull, I would like you to close your eyes. If you close your eyes, we're trying to actually get sensation, right? So if you breathe in, push the air into your belly on the inhale. Okay. And now I would like you to tension your abs so that the pressure that goes into your belly, instead of going into the belly, goes a little bit into the head instead. Don't do it too hard. A little bit, just gentle. Everything's gentle here. And see if you can notice any pressure being generated inside of the skull on the inhale. Okay, very good. And as I said, everything I've done here so far, you just continue doing it. It'll deepen. The experience will deepen. Well, studies show that your breathing actually does drive the craniosacral fluid. It drives the craniosacral pressure into the head as well. So we got two aspects there. We got on the outside, when you breathe in, the skull bones are getting slightly pulled apart, and neurocranium, viscerocranium get pulled away from each other. Okay. And then on the inside, you have all this, the meninges, the dura mater, the tentorium. This is all very, very tough. It's literally called the tough mother, the dura mater. So if you want the skull bones to move and adjust and the symmetry to improve, those bones aren't going nowhere unless the meninges changes its pattern. This is exactly the softening that Tasha, I hope, is building on that. That if you are stuck in a rigid form, essentially you need to soften that form, and that allows for the bones, the floating bones, to reposition themselves. So this rhythmic movement, the natural growth and correction comes from this. We're a big believer in that natural growth, natural correction tends to come from rhythmic movement. Okay, so what you're doing is you're feeling the natural movement that your body wants to make. This is my proposal to you. Every single time you breathe in, your body is trying to correct itself, actually. It's trying to go to its fully expanded state, which is an expanded skull, expanded jaws, everything. When you reach the upper limit of your inhale right now, you're going to start feeling tightness. You're going to start feeling the compensation pattern, the torsion pattern in your body somewhere. Working into that, easing into that, becoming like that gummy. That's what we're working on. Okay. This ties into the rest of the body in this whole body breathing format that we talk about. We have 7 diaphragms. Okay. Not super controversial. A lot of places understand you have a pelvic diaphragm, main respiratory diaphragm. We're adding in a tentorium diaphragm, so main like head diaphragm, scalp, jaw, and then your feet and your hands. Okay, so all of these diaphragms need to work together and open. The myofascial lines that connect your whole body, the breath travels through these lines into the hands, into the feet, into the head. So whenever you breathe in, there's a slight motion going through the whole body. And if you begin to work on that, you can begin unlocking areas that get stuck. You can do it for yourself, or you can have clients working on it as well. Okay. This does tie into esoteric things. So if you've heard of chakra systems or the dantians, or just the fact that we did the exercise previously where if you clench your fists, your breathing gets restricted. Something happens to the breathing. Well, when you get angry, you clench your fists. But what if you got angry one time and you didn't quite ever let it go? When I was an angry young man, I used to have back spasms and back pain, and I would wake up with my fists clenched. As I relax myself, use the breathing to open up this area, naturally my lower back decompressed, my hands don't clench when I wake up, the posture sort of self-corrects, the position of everything, since form follows function, since the function improved, the form starts to improve. If you've had heartbreak, if you've had any pattern, essentially, you feel it in your body. Your mind is not in your head, it's in your body. All your emotions you feel in the body. So if you have an emotion like anxiety, like I'm coming up here to speak in front of people, right? So that whatever I'm feeling in my body, if I push that down, my body will hold on to it physically. Hold on into it in the scaling muscles and SCM muscles in your neck. And that'll inhibit your breathing. And if it inhibits your breathing over a long enough period of time, you essentially end up in a torsion pattern of breathing. I'd just like to speak about two good testimonials that we got. Well, we got a lot of testimonials, okay? This is for practitioners and patients, right? We're essentially having people do cranial osteopathy on themselves, cranial sacral therapy on themselves. And the way we really want to use this is with the practitioners and the dentists as well, right? So that rather than continuing to just having to go to somebody to manually adjust you and do work on you, we have people capable, this is that revolution speak as well, that we have the patients that are capable of feeling their own body and feeling their own torsion patterns so that they can understand what's wrong with their body, and then they know the right people to go to. They know to go to the health practitioners, and when they need it, to go to the surgery practitioners as well. They can feel what they need. And for the practitioners, when you have clients that are repeat clients, because say for chiropractors and things like that, we get adjusted. When you have a massage and you get adjusted, you walk out feeling like a new person. And then oftentimes you collapse because you become your old person again. Your anxieties come back. Your anger, all the things that you've been holding on to in your body come back. So this is a psychosomatic change. As you work through the physical tension in the body, the personality begins to dissolve as well and change. So we can get people feeling their craniosacral rhythm to the extent that will really help the practitioners and the clients. You get changes in the mandible, freeing up of the neck. You'll get good results. That's essentially what I'm saying. And we are very much, I think everyone here, evidence focused. So if you go to wholebodybreathing.com, that's how you find me. Everything is there, wholebodybreathing.com. You'll have the scans that I've taken of myself. You'll have research papers that are backing what we say. We try to, every single thing we say, we try to look at the peer-reviewed research and see how it ties together. And the course is also there. There's a ton of free material. Essentially what I'm saying is if you continue to do what I've taught you today, you will figure out this theory by yourself. But we've been doing it for a while. We have people here that have been doing it, so we've made some connections, through the body, how the lines connect together, how the various parts of the body connect together. And the thing is, our theory ends up overlapping with other people's theories, which is really convenient. If they independently reach the same conclusions, that's usually a good sign of scientific progress there. So wholebodybreathing.com/Mew or wholebodybreathing.com, that'll get you all the information that you need to continue with this. I am here for the rest of the day as well, so as you practice this, please come up to me. And we'll continue to work on this as well. Thank you very much. Very good question. This ties back into the biochemistry of what we're doing too. Quickly, the air moving past the soft tissue will begin to irritate the tissue actually. That's why slow breathing, Takeo type breathing, that's why it's necessary. If you do that over time, the air will fill up the sinus spaces. It'll fill up the airway properly. You get gentle breaths. The inflammation will go down. And then, as we said before, is it a chicken or egg problem? That's fine, as long as your breathing improves. That's what matters.
and it works all night. So yeah, this is the kind of patient that is into face mask, is the kind that would build their own to get the most out of it. And by the way, this is another issue with face mask, is that there's not a lot of consensus on which device to actually use to pull things forward, but Dr. Khan's bow is definitely one of the best. So shout out to Dr. Khan. Dr. Khan is like the Tony Stark of orthodontic compliance stuff. She has all the cool inventions. Okay. Option 3, MARPI, so the nasomaxillary expander, plus a one-piece maxilla and one-piece mandibular surgery. So this is the third approach to three-dimensional jaw maxillism, and it's MARPI followed by a one-piece upper and one-piece lower. This approach is great for those who aren't sure if they are true maxillists yet, because they have the option to bow out of jaw surgery completely if the MARPI gets them what they're looking for. That could mean enough nasal breathing improvement and tongue space to go on living, or maybe from an aesthetic point of view, they are happy to have a wider, more Hollywood smile that the MARPI gives them, and sharper cheekbones, and can do without the big side profile change that the jaw surgery gets you. But if they feel like the MARPI wasn't enough, and they still want the surgical advancement, now they can take a simplified approach to surgery by doing a one-piece upper jaw surgery, which is simple, harder to botch, and has less risk of damaging the health of the teeth, and also a lower infection risk because there's less surgical plates. As we will see with the multi-piece maxillary surgeries, there's more plates involved. And plates are often the site of post-surgical infection. So a one-piece upper jaw surgery is also a faster surgery, which means less tissue jostling, less anesthesia, etc., which all translates to a faster recovery. And of course, the recovery is the scariest part for prospective jaw surgery patients, because, could you imagine waking up from that and having your face having been hacked off and having to deal with that experience and that pain, and, it's scary. So anything we can do to make that easier, I think, is going to open the door to these procedures for more people. Okay, finally, the last advantage of this approach, and perhaps the most important, is that the MARPI may give certain nasal breathing benefits that orthodontic surgery simply cannot. Specifically, it can expand the nasal volume vertically along the y-axis of the nose, because it spreads the nose basically all the way up to the base of the eyes, as opposed to jaw surgery, which only expands the nose up to the height of the LaFort cut. Higher LaFort cuts, as part of a segmental LaFort approach, may approach the effectiveness of the MARPI in achieving nasal volume expansion up the vertical axis of the nose, but patients who present with distinctly poor nasal breathing should strongly consider the benefit of MARPI as compared to jaw surgery when it comes to nasal breathing benefits. And I'm going to illustrate. So this here is an FME, which is the latest and greatest when it comes to MARPI, and probably Dr. Noaz will tell you more about that later. And then this image makes the point that I was just making about the effect that MARPI can have on nasal breathing that maybe jaw surgery can't. So if you see, this is the before, and then that's the after. You see the expansion is going all the way up the rim of the nose, all the way up all that. But it's whereas with a jaw surgery, it would stop at the site of the cut, which is essentially somewhere near these green lines. So in jaw surgery, they cut you there, and then you can't expand above that because you're severing the expansion vector. This we call it. All right, I'm going to speed up here because I'm running out of time. All right, option 4. The fourth approach to 3D jaw maximalism skips MARPI altogether. It involves a 3-piece maxillary segmental osteotomy to both advance and widen the upper jaw, a BSSO to advance the lower jaw, and later an SFOT and dental expansion only on the lower arch. This approach hinges on the fact that orthodontic surgeons are quite proficient in doing multi-piece upper jaw surgeries to both widen and advance the upper jaw. Most of them offer this as an option. But multi-piece lower jaw surgeries are actually much rarer which means dental expansion is still needed to get the lower jaw to match. This Marby-less approach appeals to those interested in speed and efficiency, as they can get a Marby-like result without going through a multi-year orthodontic process. For example, many patients have bites that suit a surgery-first approach that allows them to go into surgery immediately without doing any preparatory orthodontics. So why would they seek out a Marby with its cost, its known risk of asymmetry, its difficulty in splitting adult males, which of course often requires its own surgery, and 2 years of associated orthodontics, when they could go into surgery tomorrow and get an arguably more precise, more predictable expansion in 3 or 4 hours or less? Sure, the segmental LaForte does not provide the desirable zygomatic enhancement that Marby does, since the lever arm of the expansion is severed at the site of the LaForte cuts beneath the zygomas, although this can be ameliorated with malar implants such as those done by the prominent jaw surgeon Michael Bunsen in Los Angeles. And as mentioned before, theoretically, Marby does have the potential to expand more of the nose up the y-axis. But are these reasons enough to warrant the time and hassle of Marby? More and more patients are asking that question. Okay. And here in this image, you can see, this image is actually from Dr. Alfie, who's a prominent jaw surgeon. And you can see in the image, see how much wider the upper arch has been made? So that was accomplished surgically. It was advanced and widened, but then, a simple one-piece jaw surgery was done on the lower, and so this patient will need to undergo significant amounts of dental expansion with the support of SFOT to get that lower arch to match. That's what we're looking for there. All right, option 5. This one is the big kahuna burger. This is a 3-piece maxilla and a multi-piece mandibular surgery, but let's just call it a 6-piece mandibular surgery because that's the kind of surgery that Dr. David Bell does, whose images I'm going to show in this slide. So the 5th and final approach to 3D jaw maximalism that I will discuss today is a 3-piece segmental maxillary surgery combined with a multi-piece mandibular surgery, such as Dr. David Bell's 6-piece mandibular surgery. Other surgeons do this too besides Dr. Bell, but not many. This is complete and total reconstruction of both jaws in one day. Widening, advancing, re-angling, the whole 3-dimensional shebang. Specifically, what is unique about this approach is the mandibular skeletal widening. This type of widening that Dr. Bell performs is not at all like mandibular midline distraction, also known as MSDO, as MSDO widens the front of the jaw, but does not widen the proximal segments, which are pieces that are at the back still attached to the skull that are pertinent to the temporomandibular joint. Shukai, who is a very prominent yet anonymous Redditor who comments on this type of stuff, and who's, I think he's, I heard recently that he's actually working for Dr. Bell now. I'm helping him create some of these GIFs that I'm going to show you. Shukai has argued that MSDO is an unnatural kind of mandibular widening that has very limited airway and aesthetic benefits, if any at all, along with a greater risk of TMJ complication. But Dr. Bell's manner of expanding more closely mimics natural mandibular growth. He widens and arranges the proximal segments in a manner that produces better aesthetic and airway outcomes, and without stressing the TMJs. I want to show you what that looks like. You can see in this GIF. Check out this mandibular widening. It's unreal. And the TMJs are, their position, of course, is accounted for here to make sure that they're in the healthiest possible position after surgery. Boom. And this is what it might actually look like on the patient. And then check out this airway benefit. Yeah. So, of course, the downside of this approach, the recovery. There's a lot of bone cutting and a lot of plating, and more plates means increased risk of infection. Soft tissue draping into the site of the bone gaps could also be an issue if the bone movements are too much. But if you could wave a magic wand over your own head and wake up 6 months after a surgery like this, and having had it all go well without complications, that would be some result, wouldn't it? So now that we have reviewed 5 approaches to 3D jaw maximalism, I will leave you with one question. Who's ready to have their jaw cut into 9 pieces? Thank you.
Ron, thank you very much indeed. We've got a question coming in from the UK, closer to home for some of us. Where can I get a Marpe appliance in the UK?
The UK is notoriously difficult to get a Marpe appliance because it's a very conservative place, perhaps reactively so due to Dr. Mew himself, who shook up the bee's nest over there and created a reaction that's lasted years. But yeah, the UK is a terrible place to get Marpe in general. There's a few names that I could provide that they could email me and I could give them those names. But what I'm finding is that most patients in the UK are traveling either to Germany to see Chris Moschik, or they're going to Italy to see Danielle Cantarella, or they might come across the Atlantic because it's a pretty quick flight, and they might go to New York and see Dr. Nuaz or Dr. Lipkin. There's several providers in the New York area. Dr. Nuaz would probably be my referral. And then also in Turkey, there's a very inexpensive but very good option, which is Isotronile, and a lot of people in the UK go that direction too.
And we've got another question, very similar, but this time, where can I get Marpe in Texas?
Texas. In Houston, there's a gentleman named John Karakin, who is a very good Marpe provider. There's also another guy in Sugarland, which is just south of Houston. His name is Wael Kanan, and he does a nice Marpe too, and he has a surgeon that he works with named Steve Koo, who does a really nice surgical assist for adult males and gets them split. And there's others, but I think in Texas you can't go wrong with John Karakin. He's a pro. He's been doing this for many years.
Ron, thank you very much indeed, everyone. This concludes all of our morning sessions. We're going to have a break for lunch. During the lunch break, Dr. Mike Mew will be interviewing representatives for each of our sponsors, that we will share these interviews live over the internet to all of those following the event remotely. And then after lunch, we will be reconvening back here for a host of other interesting speakers that I'm sure you're all looking forward to hear. Thank you all very much. Back here for the children. Sorry?
He needs a microphone.
We'll have the handheld microphone.
Yes. Do I get it from there?
That's my book. I can't lose that because that's got like
Okay, we're ready to go. Right, the mics are on. Right, test the mics.
Yes. Okay. So
Oh, sorry, the acoustics is terrible.
yes. Okay, so I'm going to introduce Nick from Jawliner, our main sponsor. Okay, so I'm pleased to introduce you. I'm here with Nick from Right. So I'm here with Nick from Jawliner. Okay. Right. Do you want to build a headspace? I'm here with Nick from Jawliner. Nick, listen, thank you very much. You are the main sponsor of the event. You have helped to make this possible. I've clearly worked with Jawliner before. Some of these great products you've got here. You've got some questions for me today.
Yes, I do. Appreciate your time and efforts for the whole MewCon. My first question I would ask you is, what's your first thought about trying that ultra hard gum, and what kind of muscle activation did you notice?
Okay, so that ultra hard gum is seriously strong, and having to do a lot of muscle activation. What I really like about gums like this, it's a little bit like free weights. You know, you've got to do the contralateral control. You know, it's the fine proprioceptive control when you're having to do this that you don't get without chewing something between your teeth. Something that you can enjoy chewing. When I'm treating patients, what I notice is that if they enjoy chewing something, they'll do it. And a lot of gums and devices and things people don't enjoy, they don't do it.
Right. Fantastic. Great answer. So why is it important to chew hard gum, and what are the health benefits?
Okay, so my first proviso is that you don't have jaw joint problems. So if you don't have jaw joint problems, using gum develops the facial musculature. I put it very simply. I say that we all swallow processed food. Either you have that food processed by a machine, or you have that processed by this processing unit.
Okay.
Now, if you want this process unit to be well developed, as I've got a good developed process unit, and that's because I've used it. And the more you use this system, the more developed it becomes. It's not complex. The whole world of mewing has been about the realization that not only can we build this system, but we can also build this system. And we can do it by usage.
Fantastic.
And tough gums are really integral in that.
And how does the chewing gum maximize the actual jawline training results?
Sorry, say that again?
Yeah, how does chewing gum maximize jawline training results?
Well, chewing gum, you require your muscles of mastication. And in many ways, the face is defined by the muscles of mastication, their effects on the underlying bone, and of course, the facial structure in general.
Perfect. And how does mewing and chewing hard gum create a well-rounded approach to jawline training?
I think that tough gums, muscle usage, is an intrinsic and very important element in developing good facial and healthy form. It's not the only element. You know, you need good head and neck posture, you need good tongue posture, you need good lip seal. But this is a really important part of the mix, and I really promote good tough gums, things that people enjoy chewing. Again, with that proviso that you've got a healthy and unsymptomatic jaw joint.
Fantastic. Several more questions here, and we'll wrap up. So, studies show gum chewing has many health benefits, such as relieving stress and anxiety. How can chewing hard gum contribute to these benefits?
Sorry, say that again?
Yeah, studies show that gum chewing has many health benefits, such as relieving stress and anxiety. How can chewing hard gum contribute to these benefits?
Well, I think that from what I observe, these are indirect effects. I think that if you develop good form, but also if you build up good muscle tone within your throat and the back of your tongue, that can really assist with good nighttime breathing. And that then has a knock-on effect of helping to reduce anxiety and these problems. So it would appear from the research.
Fantastic. And our ancestors chewed hours per day to keep their teeth straight and jawline strong. How can chewing hard gum bring back some of those principles we've lost over the years?
Well, I think that, you know, an anthropologist has told me that he feels our ancestors were chewing 30% of the day. Now, I don't think we want to rewind the clock and live like our paleo ancestors. However, what we do want to do is try to blend what we can from products like Jawliner to help people develop better facial form and, of course, have better muscle tone and strength. And I think it's really important trying to use history and anthropological research to inform us about what steps we can make to gain improvements in health and facial architecture today in the modern world.
Fantastic. Last question is, what is the biggest difference you've noticed chewing our hard gum versus regular chewing gum?
Well, having tried Jawliner, going back to normal regular gum, I can't do it. Sorry, I can't go back to normal gum. It feels like you've got nothing between your teeth. It feels, you know, I like to bite into something, and of course, normal chewing gum can be really useful for the tongue chewing exercise. Okay, you need a relatively soft gum, preferably a not too minty gum for that. But for normal tooth-to-tooth chewing, I like Jawliner. There's several other brands on the market as well that you've got good competition. Excellent to see because I like competition.
Exactly.
Jawliner is a great gum. I've used it and I enjoy it, and I can't go back to regular gum now.
And thank you, Dr. Mew, for the interview, and appreciate your support for Jawliner.
Okay.
Thank you.
Fantastic.
All right.
I hope that's what you wanted.
So, yeah, no, that's great. Thank you.
Okay.
All right.
Okay, so I'm here with Anders from REM Sleep Remastered, correct?
REM Mastered Sleep.
So much going on today. My little brain's going woo, 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 and I'll tell you what, I am thirsty. A great idea.
Yep.
You know, really intuitive, forward thinking,
Yep.
and helping people change.
Yeah.
You know, go quickly over some of the things that you helped you come to this concept.
Yeah, so really what we're trying to do is get good tongue posture easily and quickly. So kind of what this is it's a workout tool for getting that tongue posture. So you're doing tongue suction, where you're suctioning the water up into your mouth, and then just doing these little tongue push-ups in repetition. What that does is you're having the correct oral positioning, and just makes it really easy to get that tongue up. So it's really good for tongue posture.
Well, what you're doing is you're making, and you know, I'm thinking of the kids more than the
Yeah.
adults usually, sometimes, you know.
Yep.
But you're making them work to get their water.
Yeah, so they're actually doing proper myofunctional exercise.
And of course, it's really important to have devices that force you to do something. We often say youth is wasted on the young. Because they don't see the need to do these changes. What they see is, well, they don't see any need. They'll only do it when they have to do something. And what this device is doing is it's making kids work for their water.
Yep.
Making them exercise, forcing them to do that. And of course, well, I don't care. Why, you know, all I want them to do is the exercise.
Yep.
Okay? If we have to force them, great, because they need to do their exercise. You know, we don't force them to watch the internet, do we? And they'll watch the internet all by themselves. So whatever we can do to tag someone, whatever we can do to game change, and I love the idea of this, because I think it's beautifully simple. It can be very effective. I mean, you've got some research now, or...
Yep, we're doing a study with Mayo Clinic for obstructive sleep apnea, and then a variety of other studies, all the way from like with dentists, looking at like how does that affect oral growth and development, as well as stuff with myofunctional therapists and speech language pathologists. It's a lot of cool stuff coming, and we do have like lots of case studies. So we have one in particular. If you go on to remmasteredsleep.com, go to healthcare professionals and the case studies. There's different cases where like a little 6-year-old boy, very narrow, high vaulted palate, not eating different foods, has full native into his mouth, and after 3 months of use, just crazy like the growth, and now eating foods it never ate before.
Well, fascinating how I think there's a link between, well, we know that actually when you eat things, most of your taste is processed through the nose. And isn't it interesting that these kids with these narrow palates are big fussy eaters?
Yep. Yeah.
And maybe that's because they're struggling to breathe out the nose and chew and swallow all at the same time.
Yep.
Maybe that's because they've got maxillary deficiencies.
Yep.
And isn't it interesting that we've got this massive increase in fussy eaters?
Yeah, all the soft foods. I grew up on mac and cheese. But yeah, having that good tongue posture, you're naturally nasal breathing. It forces you to nasal
then
breathe.
you enjoy and appreciate your foods.
Yep. Yeah.
And then you stop being a fussy eater. Here we go.
Yeah. Yeah.
Cheers. Okay, listen. Thank you very much for being one of our sponsors. You know, you've really helped put this forwards. You've really helped us organise an event. This is the first event of its kind ever. I hope we'll look back in time to say this was the beginning of an era.
Yeah, well, I'm excited for the future. Just bringing together all these amazing professionals as well as people in the community who are passionate about airway health, mewing, all the things. They just want to live their best lives. How can we change like what's happening in society? You know, or just the soft foods, you know, more bottle feeding. Like, how can we actually do it where we developed our optimal potential?
There is so much to do, it's crazy.
Yeah, this is just the beginning.
This is the beginning. This is the beginning. It's a great start. Great having you here.
Yeah, thank you.
Thank you very much.
Yeah, thank you.
This camera. Wait 1 second. Guys, can we go by? Oh, no, you can't. No. Sorry.
Stop.
Okay, I have the real pleasure to introduce Coco. Coco from the Coco
Face Yoga, yes.
Fantastic brand. Coco, you've come from this to the same place as me, coming from a very different direction.
Yes, I'm more focused on the face, but the main thing is mewing. Yes.
Mewing is my functional therapy. It's oral posture and function.
Right, and it's a core muscle. Tongue is a core muscle for the face.
Yeah. And of course, what I love about medicine is when different people from different directions come to the same conclusion. Because then you know you're onto something.
Yes.
And the more we can work synergistically together, the more we can help people.
Yes.
And I want you to talk about this.
Yes, sleep tape.
Products to help people because you know we've got great innovation.
Right.
You've come up with this product.
Yes.
Tell me a little bit more about this.
Yes, so lots of people open mouth and
it's particularly at night.
Yes, at night. It's really bad.
It's usually bad.
Yeah, then you use tape, right?
Not often actually.
Okay.
But my kids.
Okay, they
stick
do.
the tape on every. I mean,
okay,
my
that's
oldest
good.
Jessica doesn't want to go to sleep at night without tape on.
Oh, she's so good.
Yeah?
She's so good, well trained.
Well, I'm going to try over some of it.
Yes, please,
And I'll
because
give you
this
some
is really.
images, I'll give you some feedback, and I'll give you. I promise I'll get her to make some words. For
Yes,
herself.
please.
Yeah?
That would
She's
be
very
great.
articulate.
Yes, the thing about this is that the other tapes, it's very big. I don't like it. It touches all the skin, and you could do like this. The jaw is dropped.
Yeah.
It's not good.
No,
You want to
you're
lift up the jaw. That's why I like this smaller size to train your lip to close and jaw up, not just the lip.
Yep.
Yeah.
Cool. Excellent.
That's why I like this smaller size.
Okay. So you're not. I mean, Coco, not only are you one of the sponsors of the event, but I couldn't have done this event without you.
Thank you so much. Well, I'm honored to be here.
That's fantastic. You're nicely organised. You're on it. I mean,
Oh, my
every
team,
time we
Micah.
work with you, it's
Yeah.
dum, 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 dum.
Well, please say thank you to Micah too.
Thank you for
Micah, Micah.
Thank you very much indeed.
Bill is doing this too,
Well
Micah.
done. And listen, you've helped put this on.
Yes, that's my pleasure.
And, you know, listen, it's not just about this.
Right, it's a beginning.
It's exactly.
Yes.
It's this journey we're on, where we're going to go,
Right.
and where it goes to. All right.
Yep.
Okay.
So let's do it.
Thank you very much indeed.
Thank you. Thank you so much, Dr. Mew. Okay, cool. Thank you.
Will invade your body space.
Oh yeah,
Just
no,
push
you're
me
fine.
away.
We'll get it on tape.
Okay, so I've got the real pleasure to interview Dr. Katie Kennedy. Katie's come up with this really novel, clever idea. We all know the importance of mewing, myofunctional therapy. I mean, it's just, you know, the research just on sleep apnea is incredibly powerful.
Exactly.
I think we're going to learn so much more importance. Of course, tongue posture, tongue function, we understand the importance of now. What we need to help people to change is devices, and devices to help them train. And you've come up with a device you're going to talk about today.
Exactly. Thank you, Dr. Mew, for hosting this and bringing everybody together to share ideas and concepts.
Thank you for
so much.
sponsoring us, because without our sponsors, we couldn't put it on.
I'm so happy to be here and introduce Beauty Balloon. We are launching this week. And what I like to call this a tool, right? Like you said, a tool to help us exercise, build strength, build the tongue strength. And I refer to it as a health and beauty tool, because we know function is very important, and then aesthetics follows good function. So they go hand in hand, exactly. So I like to call it a health and beauty tool. It's called the Beauty Balloon tool, and it strengthens the tongue, lip, and cheek muscles, because these muscles have to work in concert, so we have good function for swallowing, speaking, eating, and we don't want to mouth breathe. We want to really strengthen the tongue to nasal breathe. So for fun, let's do some exercises.
Okay, so
this is live.
I've never used one
That's
of
right.
these before.
That's exactly right.
So let's see how it goes.
Yes. So first we're going to do what's called the tongue trio. You're going to open it up, keep your shoulders down, good posture, head up, just like you talk about. Open it up, and then you're going to bring the tool towards you, and you're going to push the tongue in the attachment site. So it's resistance training. The whole concept is resistance training. Pull it forward, push your tongue against it for resistance. So hold that. And then you can pull back and repeat. So you can do it as isometric, or isotonic.
So isometric is when you don't change the length of the muscles. And isotonic is when you change the length but keep the constant force.
That's exactly right. So you can do either one. You can do repetitions or you can hold, exactly. And you want to really have a straight, firm tongue when you're pushing forward. You'll see a lot of the time people use a spoon or some other type of tool. This is very nice because it gives you spring, push, pull, more resistance, and you have to focus the tongue in the attachment site. Then the other one is the two-step. Let's switch and we'll do the two-step. You're going to put the tongue through one of the holes. Tongue goes one way, and you're going to slide the tool opposite. It's called the tongue two-step, and you can hold.
Okay, so we're doing some sort of lateral resistance.
Correct, exactly. Lateral in this plane. The first one was the anterior posterior plane, front and back, front and back. This one is the lateral plane, left to right, opposite. So, in, pull then the tool to the right as your tongue moves to the left. And then pull back and do it in the opposite and hold. Hold so you can feel that resistance as you're doing it. Let me see. Yep, tongue going that way and their tool is going that way. Yeah, exactly, right? You feel that? Yep, tongue toward me and then the tool goes to the right. Yep. Exactly. Lateral plane resistance. Then thirdly, we're going to do superior, inferior, north, south, if you will. Open it up. Tongue protrudes over the attachment site. And then you're going to push up on the tool as the tongue comes down. You can also flex the head a little bit and rock so you can get that resistance. Love that one because you also, right, you feel that?
I was just thinking, yeah, I'll come back to that. My thoughts. Okay, and you're going to laterally with that as well?
Yep, you can wiggle it around in all different ways. Many different, there's so many more, I'm not sure we're going to have time.
No.
So that's, what I like about that, it's one shot. All three planes are taken care of with one tool in the same position. Very fast and effective to knock out your exercises.
And of course, without some type of device, it's quite hard to get resistance on the tongue.
Absolutely, that's our challenge.
I remember, because I've done surgery, and I've done surgery on tongues, and trying to hold that beast, I tell you, it's hard.
Absolutely.
It slips off the plate, so to speak.
That's exactly right. That's exactly right. So this gives you exercises, very simple, and there's a lot more.
Yes.
Why don't we?
Do you want to do more or leave with the simple?
Do you want to do? I was going to show you one.
Let's do one more. Let one more, because otherwise people have a.
Yep. Yeah, I don't.
Keep it simple.
Right. Yep. So that's called the butterfly for obvious reasons, as it opens up. This one is called the original triangle. Just going to see this one. Let's take the apex. Put it behind the lower teeth, so you have to open the mouth nice and wide. And then you're going to put the tongue through the apex. And now, I call that the tongue reverse plank. And now you're going to twist your tongue without moving the mandible. Right there. Move the tool side to side. I know, challenging. And that is an advanced move. That's going to take coordination, and you have to hold the tongue.
What I really like is I like types of exercises that children have to master. Because if they can master that, then they've demonstrated that they've done hard work.
That's right. And that's an advanced move that we just did.
Exactly. Well,
that's
really
advanced.
Because kids love to have a task, a test, which they can excel at and which they can do.
That's exactly right.
That sounds great.
Yeah, and that's, we call that the reverse plank with a twist.
Now, are you working at all with people doing tongue ties?
I don't personally do the tongue ties, but yes, this absolutely plays a role with that. Absolutely.
Particularly with the
trampoline.
The trampoline.
Correct.
That was the one I'm thinking I can feel stretch in my lower tongue.
That's exactly right.
I think that's really useful. So it's beneficial, it's synergistic. Okay?
Absolutely. Absolutely.
Don't have your or your child's tongue tie affected unless you've got a really good plan for preoperative and post-operative stretches. I'm fed up with seeing tongue ties reversing after surgery. It's a waste of time.
Right. You don't want the tissue to scar down and become hard and fibrous, right? Scarring. That frenulum tissue scars, and that's exactly what can happen.
You can easily be in a worse position before you started. And so, do exercises.
Soft.
Think of devices that can help you with those exercises. Otherwise, don't do a tongue tie revision.
That's right. That's right.
All right?
Yes. And do you want to do a few more, or are we?
I think
we're going to run out of time.
I think
we'll pick it up.
Listen, Katie, thank you very much.
Thank you, Dr. Mew. Yes.
Thank you for helping get this meeting off the ground. And listen, I look forward to working together.
Yes, absolutely. Lots more to do.